Hey. Hey everyone, happy Tuesday. Welcome to our X39 Stem Cell Activation Science and Tech Zoom. I am so excited you decided to join me tonight. I'm Dr. Stacy Holweger. If you are a guest here, if you're returning, I am joined by an amazing doctor, chiropractor, Dr. John Harmon, and he is going to be sharing information with you tonight on LifeWave's stem cell activation technology, as well as probably some of the other tech we'll get into as well too. Before we get started, I wanted to let you know that neither Dr. Harmon and I are medical doctors. He is a chiropractor, of course, and I will share his bio with you here shortly. And I am a doctor of holistic, integrative, and functional med. And so if you have a question in regards to your health, medications, or what's going on with you, please check with your healthcare practitioner. The information that we are sharing this evening is not intended to prevent, treat, cure, or diagnose any type of disease. We won't be referencing any diseases. Of course, Dr. Harmon will be sharing information with you in regards to our clinical studies, and those look at the systems and organs in the body and the cellular function. So let me go ahead and read you his bio. So Dr. Harmon is married to Carla, and he's a father of 8 children of his own and 2 stepchildren, so 10 children between the two of them, a grandfather to 26 children. Can you imagine keeping track of 26 children, grandchildren?
No, I can't.
I know sometimes you joke and you're like, okay, what if I did one every single day, one grandchild every single day for lunch for the month? It would take you almost a whole month to get through, right? He speaks fluent German. He has a Bachelor of Science in Human Biology. He attended the University of Utah from 1983 through 1986. He graduated summa cum laude with a Doctor of Chiropractic degree from the Los Angeles College of Chiropractic in 1989. He is a board-certified EEG, quantitative EEG, and neurofeedback ICP, which is a certified practitioner. You're definitely going to get to hear more about his specialty in the brain. He is the president and founder of Clear Mind Idaho. He is an executive director in LifeWave, which is one of our top 3 ranks in the company. He's played the drums in a rock band starting since junior high school through college. And most importantly, he is the marbles champion of his elementary school. I love it. Dr. Harmon, it has been a joy the last 2 years getting to know you and work with you. And, we've done some deep dives on clinical studies. We just taught on compliance last weekend. And so I'm so grateful that you took time out of your evening and your practice to be able to share with everyone your knowledge and expertise on the LifeWave stem cell activation technology.
Likewise, Stacy, it's been such a joy getting to know you. Like a year and a half ago on the bus down to Tulum, we happened to be on the same bus, and that's the first, in-person interactions we had. And ever since then, we've been friends. I got to meet her husband and Brent, and she got to meet Carla, and it's been a fun association, that's for sure. Absolutely. And then doing some of the webinars together, it's been fun.
Absolutely. So, Dr. Harmon, why don't you go ahead and give us a little bit more into your background using this technology? You've been using this almost 3 years, is that correct? And tell us what your practice and your world looks like.
Yeah, 3.5 years almost. I started the first week of April 2020. So I'm one of the old timers. So it was really interesting starting right in the middle of the shutdown of everything. Everybody's scared and don't know what's going to happen, looking behind the corners of everything. And but we were shamed into closing the clinic as well. And I had 2 months to just focus on LifeWave. And I said, man, I'm going to take advantage of these couple of months and just hit it really hard. So when Marcy and Peter on the Zooms were talking about 3, 3, and 3, I think I heard 300, 300, 300. We get up really early, like 4:15, and work out. And so I was sitting in my office formulating these texts and these instant messages, like a lot of them. And I'm thinking, okay, I'm going to say, oh, shoot, it's only 7 o'clock. And then I would wait till about 9, and then I would send them all out. And sometimes by noon, I was delivering, I was giving out samples then. I don't do so much of that anymore, but I would meet them in the Kohl's parking lot, best in meeting. Hopefully we didn't get seen by anybody, and hand off the patches. And a couple of times people were calling me or texting me before they even got home, before I got home. And they said, yeah, I went on your website and signed up. And I go, oh, this is pretty cool. So that's how we got started. My friend Savvy called me and said, what do you know about stem cells? And I had stem cell injections in both of my knees. They helped a little bit. But then he said stem cells and a patch, and I said, I'm in. And ever since then, it's just been part of my world, part of my practice. Friends, family, organic conversations about health lead to, hey, have you heard of this new stem cell activation technology? And that leads to, either a customer or a branding partner. And that's been a really interesting thing. And then incorporating it into the practice. And I think I'll kind of focus on that. About people ask me all the time, what do you do in your practice? How did you incorporate them into your practice? How do you start that conversation? What can I tell so-and-so chiropractor, naturopath, medical doctor? What can I tell them to get them to look at the patches? I say, don't treat them any differently than just a layperson as far as how you introduce it to them. Here's what I'll tell you not to do. Don't go in for your appointment. Don't make an appointment with the sole intent of trying to tell them about LifeWave during your appointment. You are setting yourself up for failure if you do that. And here's how I know. I've been practicing for 33 years, and over my career, lots of patients have had a little brochure in their hand when they come for their appointment. This is what goes through my head. Oh, crap, I'm going to be behind the rest of the day because somebody's going to try to sell me something. I never, ever joined or purchased anything from that kind of an introduction. So get their email. Send them an email. Hey, doc, do you do anything with stem cells in your practice? Answer back, no. Have you heard of the new stem cell activation technology? Is it okay if I send you a link to a short video? Don't send 13 studies attached to that email. The doc's going to look at it and go, I don't have time to read that. I got a patient in 2 minutes. So they are a little bit different in that you have to be acutely aware of their time, and they're not going to be very open to talking to you during the day unless they don't have any patients. And, usually I say this fondly, doctors don't even have time to pee. Literally, you're patient to patient to patient to patient. And so respect that and give them the benefit of the doubt, as far as, not the benefit of the doubt, but the privilege of hearing about LifeWave the way that everybody else does. Keep in mind, doctors have a large database. It's great if you can get them on board, but most of them it's going to be where you are doing the follow-up with their people. They aren't, they're not necessarily going to be really active in building a business. I'm different. I do, but not everybody's like that. So just anticipate that you are going to be really busy with people he piques. He'll pique their interest, And then a lot of times you'll have to do the work. You have to pull the load in doing that. And it's okay. And you're going after that database. A lot of patients. But here's the other thing about doctor's offices. If you want me to slow down, Stacy, you just have to shut me up.
No, you're perfect. Keep going. This is fantastic.
Here's no, I lost my train of thought. It'll come to me.
Database. They have a database, and it's your job. They're going to pique their interest. Your job to do the work.
It wasn't the database, but it's this. Most doctors have, different things that they do, but packages of things that they do. What is their baseline? Do they help people with their hormone levels? Do they do a lot of blood work? Is it a chiropractor? Is it a naturopath? Do they do IVs? Whatever they do, talk to them and find out what is a package that they normally do for this thing, for this disorder, or for that disorder. And then it's a real easy add to any package. $100, you get your first month of stem cell activation patches. And here's what that does. Every single patient that the doctor has come into their office, they get to talk about it on their very first visit. Then, sometime down the road, 2 weeks, 3 weeks, whatever, I might bring this up. Even if all they do is broach the topic and they talk about the X39, that starts a conversation. And so rather than leaving it to more to chance or the doctor's memory that, he remembers to tell about it or the staff or something, if they have it in a package, then it's easier to bring that up and talk about that.
Mm-hmm.
So I hope that's helpful for your listeners on how to not approach your doctor, how to approach your doctor, and then a little bit about, adding value to their package. Mm-hmm. If they do stem cell work, here's what it sounds like. The doctor talking to the patient, Mrs. Smith, we're going to give you this blah, 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 this stem cell thing, or PRP, or whatever they do. And we're going to elevate your stem cells by giving you this big flood of stem cells if they do stem cell injections. Then we're going to give you a month's supply of these patches that will elevate your stem cells on a time release basis every day, so that you'll get more rapid healing and a sustained release of, for repair and regeneration. That has worked for doctors' offices as well. And that's what I do in my practice. My practice is different. People say, well, you're a chiropractor. How did you get to why are you doing all of this brain stuff in a place called Clearmind? A lot of stuff went down a few years ago. I'd been in practice about 22 years. And then my 18-year-old niece committed suicide in March of 2010. In March of 2011, my oldest daughter's husband was murdered. And then my sister died the next week. It was 3 years, one, 2, 3, boom, boom, boom. Left my younger daughters with anxiety, depression, insomnia, 4 years of counseling and prescription drugs, really didn't do anything. So we were quite frustrated. And it was at that time I was trying to find things to fix my family's brain. And I was led to neurofeedback, mm-hmm. and brought that into my practice. And in the midst of that, another pretty crappy thing happened. And that was, I went to the dentist for some dental work, and he had to put a dental dam in, and I get all, people in my face and the dental dam. And so he put me under conscious sedation and did a root canal while I was out without my permission. And a week later, my right wrist puffed up like a football, and I had osteomyelitis. 50% of the people who get that don't make it. And so I was forced into making some decisions. Is it over for you, John, now? You know, you can't practice chiropractic, you can't play the drums. Are you done?
Wow.
And after a little bit of, feeling kind of sorry for myself, I said, you know what? This isn't going to be the end of my story. I have a lot more to write. So I just kept writing. I realized I needed to get some specialized education. So that's when I went and got board certified in reading EEGs and knowing what it means and what to do about it. And off I went. And then I started getting education on laser therapies called laser, and then functional neurology. So I combined the best of those three worlds into a place called Clear Mind, Idaho. And now we help people get their brains right. And we say, it's not a life sentence. We can.
Wonderful. Wow.
And so that's been my path, my journey on how I got to this point. That's why in that study you and I did, the review of the quantitative EEG, meaningful to me about that and seeing how it changed coherence. And coherence is a measurement of how much crosstalk is going back and forth between two analogous lobes. So the two frontal, the two temporal, each set of lobes, different things happen on different sides of the brain, but the brain's always talking to the other side. Hey, I did that. What about that? Yeah, that's good. Okay, keep that up. There's always crosstalk going on. So the LifeWave study looked at coherence, crosstalk, and where there's too much crosstalk, you get all jammed up like on the freeway at 5 o'clock. There's nothing happening. You're just like thinking through frozen molasses. The interesting thing about that, the more hyper coherence one has, the more autistic one is. And then they looked at hypocoherence, which is there's not enough crosstalk, and that's cognitive decline. Here's the thing. Every single one of those participants, the X39 had kind of like an adaptogen effect, an adaptogen herb, where, if it's doing too much, it brings it down. If it's not doing it enough, it brings it up. So the X39 was kind of like an adaptogen for the brain, where it brought down the hypercoherence and brought up the hypocoherence, so the brain works better. So that absolutely fits right into my practice, but there are other studies done too. And help you out. I think I'll go ahead and talk about what I just announced today. You look at the frustration that we go through when a doctor says, well, what effect does this have on exercise, or what effect does this have on nerve regeneration or whatever? So within the next week or two, I'm going to be finished with a book called How to Reverse Aging, a comprehensive guide to copper peptides. And it's a reference book. You can look it up. You can just say, okay, what is it to have? On page 233, it talks about the effect of the X30 of GHK copper peptide on nerve regeneration, on the brain, on the skin, on exercise.
Wow.
All of those things, you'll be able to do that in that book. So that's what I've been working on. I just got the front cover of the book me today. It's pretty cool.
It looks amazing. I cannot wait to get this book. This is going to be a huge resource for everyone in LifeWave to be able to just have a clear, concise, cut and dried, just like you said, A to Z, turn to this page for this, this, and this. And oh, look at that. That looks amazing, Dr. Harmon.
Thank you. I'm pretty excited about it when he sent it to me this morning.
Yeah.
So that's been fun. And you know what? I talked about that EEG study, the quantitative EEG study, and yeah, it changes coherence and hypercoherence, hypocoherence. But in the book, talk about why, because it affects neurotransmitters and it does this and it does that. So those of you who like the details or want to be armed and ready for those people who like the details and, who do I call? What am I going to do? So I think it's going to be a good reference for everybody to just look at this page right there. And then it goes through, and how do you get peptides? Well, there's lotions, there's potions, there's creams, there's shampoos, there's injections, there are IVs, and then there's this phototherapy patch that David Schmidt invented that elevates your peptides. So that's in the book too. It's not a commercial, and I walk a fine line between a promotion. It's just mentioned in the course of the book. But here's the kicker thing about the book. The actions of the effect that the X39 has on our body is the effect that the GHK copper peptide has on our body. So if you learn everything in that book, first of all, you'll get a deeper conviction of what we have, and you'll know how to, when needed, give that person, that analytical dude or a woman. I saw somebody raising their hand just a minute ago. Yeah. So you have the ammo to throw back at them.
Well, they're wanting to know when it will be available. When can we purchase it?
In a couple of weeks. I'm going to announce it. I'm going to have the first 100. I'm going to have signed copies. So those, actually, the payment will go to me. Then it'll be on Amazon. So if people just want to send me an email, that wrist that I got infection in, well, that's my right wrist, and it doesn't bend anymore. So it's a little harder to sign. So I'm going to do a ton of them, but I'm going to do 100 of them. So those will be a little bit different. If they'll just send an email to Dr. Harmon at GHKbook.com.
I'll type that in the chat for everyone as well too. Dr. DRHARMON.
Yep, at GHKbook.com.
GHKbook.com. Okay, so you can email him. The first 100 are able to have a signed copy. Just count my admission right now, Dr. Harmon.
You got it.
Oh my gosh, I love it. I'm so excited for this. I love having resources and references, not that you're going to be making claims about X39, but to go deeper into what David did, which was that research with Dr. Lauren Picard and the benefits of elevating GHK copper peptide. But this is in a non-invasive, accessible, simple, easy, and affordable way. So we're so excited to have that resource in our hands.
Yeah, it doesn't even mention the X39. It just says phototherapy patch, photobiomodulation. It mentions David Schmidt, but not LifeWave.
Fantastic.
Intentionally so.
Of course.
I don't want any taste of promotion.
Right.
I want it to be just a factual book. The thing that was so astounding to me when we started digging into this, there's a lot more stuff than just Lauren Picard. I mean, studies about how it affects exercise, cardiovascular health, all kinds of things. And that's all in it.
Yes, we're looking forward to it. So would you like to screen share your PowerPoint and tell us a little bit more about this peptide and how it impacts our X39 stem cell activation patch?
Yes, let me make sure the right one is open.
Okay.
Before we do that. So here's the one that you and I did. And I'll be able to talk. Are you talking about, you want to know about the brain stuff or just the science in general?
Just start with the general science of the X39 stem cell activation patch. And of course, we definitely want to hear your personal experience as well too, with your heart and what you experienced in your body.
Okay, I'll do that. I have just a few slides on another PowerPoint, but I'll just,
perfect.
We'll just start right here. Okay. So this is one of my favorite slides I've ever made. X39. So the first one we went over was on the X39. You know, there's this, and there's so much more in the book that I think I'll just skim through these a little bit. The patent for this technology was granted by the US Patent Office after this study was presented. And what they did is it took blood samples before and then as people were using the X39, and they found out that there were some dramatic increases in the GHK copper peptide. So remember, everything we talk about, what does the patch do? It parallels what the GHK copper peptide does. So here's what they did. They randomized, they took the blood, more blood was taken here. There was a significant increase in the GHK compared to the control group. I think I'm going to just tell you a few things because there's like 5 pages of the things that are on Dr. Picard's website and others. But here are the basic things about what the GHK copper peptide does. It has a lot to do with collagen repair and replacement, but also collagen destruction where there's too much, like scar tissue. So you have normal tissue that's really flexible, and then you have scar tissue that's inflexible. Why is that? It's because there's a haphazard deposition of collagen rather than lined up in the lines of movement and stretch, and then it becomes more flexible with this remodeling that occurs as a wound is healing. First it patches it up, first you got a clot, then it patches it up, and then it starts getting infiltrated by capillaries. And then you get this remodeling of this wound site, and now it more closely resembles normal tissue where there's an increase in the GHK. Now, normally, actually, GHK is known as the emergency response peptide. So when something goes down, you got a cut, you have an injury, you fractured something, up goes the GHK level in your bloodstream. It attracts new blood vessels into the injured tissue, and the whole cascade of events that happen, including activating your stem cells. So this is what the GHK copper peptide does. The peptide itself, we say copper, GHK copper. So there's a copper atom on one end of this peptide, and there's an amino acid on the other end. The copper holds on to and is a donor for electrons. This is why it's so active in so many pathways. It's not just a few, it's hundreds, maybe even thousands of pathways. It turns them on. So everything that happens in our body is about moving charge, moving electrons. We eat so that we can break it down, so we can get electrons from it and store it as a substance called ATP, and that is used as our gas. If we run out of gas, we don't live. And everything that happens is about moving electrons somewhere. And the GHK copper peptide is used as a switch to not only turn on different pathways, but also to accelerate gene repair. It has anti-cancer properties. It has, I might just, put different ones up on here. It has so many benefits for so many systems that it's almost hard to, here's the big one. It activates stem cells. It accelerates the speed of wound healing, beneficial for hair, skin, nails, tightened loose skin, repaired protective barriers. And it almost sounds like it's too good to be true. It does all those things, really? But it does, because of the nature of the peptide itself. On the other end, you have an amino acid that gets donated where collagen needs to be repaired. So it's kind of floating around in the body, and whatever I need to do, I'll do it with the copper side, or I'll do it with the amino acid side. I'll donate this, I'll activate this, and turn on this pathway with those electrons that are part of the structure of the GHK copper peptide. And after it donates the electrons, you'll have GHK in your blood, and you'll have GHK copper, and it goes back and forth between those. So you can see there are a lot of advantages there. Let me just show you this. If you look up on PubMed, GHK copper peptide, this was a screenshot that I did when I was preparing for this thing that Dr. Stacy and I did. But there are 13 pages of studies that have been done. We've been digging through those and for this book, so it's been really interesting. And here's one that talks about wound healing and cell proliferation. What this is, angiogenesis. When you are injured or when something happens, your body has to rapidly make new blood vessels. And the GHK attracts those into it. It's called chemoattraction. It attracts the capillaries to rapidly go into that damaged tissue and start repairing and bringing in blood and oxygen. So regenerative protective actions of the GHK copper peptide in light of the new DEAM data. And you can read through this. And having done this myself, I know how hard it is to go through studies. And that's one of the things that motivated me to write this book. So in research, they're not trying to prove something is true. They're trying to prove something. They're trying to come up with the probability of something happening randomly. So the lower the number, the better the chances are that what happened in that study just wasn't a random occurrence. So the p-value with the study was 0.03. That means it has an extremely low probability of happening by chance. And that is a good value right there on that study. And this is where we went into the Alavita study for you, Dr. Stacy. And what else? What was it, the other thing you wanted me to show?
I wanted you to share with them your experience in using the X39 with your the PVCs and the different things with your heart and what you've experienced yourself.
Okay. You got it. Let me open this one up then. It's a little bit different one. Hopefully it will let me do this without getting all wigged out on me. It's not going to let me. I'm going to have to scroll through this. It won't let me get out of. Sorry about that.
That's okay. No worries.
I'm going to get down to. This is a presentation I did for Dr. Tom Cowan, and his. He has a group called the New Biology. And they don't believe a lot of the bull we've been fed about the body. And they're trying to make changes in that. Okay, so I'm going to show you this first. This will help you understand how the patches work. Imagine you walk into a jewelry store, you go up to the diamond cabinet. There are always bright lights shining on diamonds in jewelry stores. 100% of the time, you're going to find those. But you walk up to them and you see all of these colors. Reds, yellows, blues, greens, orange. What the heck is that? You wonder, the diamonds are clear, but I'm seeing colors. Well, the diamonds are separating out, they're refracting out the different wavelengths of light that gets interpreted by our eyes and our brain as different colors. Here's how it compares to the patches. Your body is the bright white light. David invented new crystals that have their own crystal lattice structure, which is how the different atoms of different and the ions form together. What shape is it? For example, sodium chloride, perfect square. No matter how much you crush it, it will be a perfect square. That's why you can balance the salt shaker that has a 45-degree cut on it on the table. Ask my wife. I do it every time we go to a restaurant that has those. And I balance the salt shaker. Well, each crystal has a different lattice structure. David developed crystals that will reflect back part of the frequencies that we are emitting into our surroundings. And they were able to figure out what frequency, if I could get it back in the body, would turn on this GHK copper peptide factory. Like when you go out in the sun, we have trillions of nano antennas in our skin. The UVB light stimulates them with UVB, and it signals your body to make more vitamin D3. The same antennas with a different frequency will stimulate, it will tell your body to make GHK copper peptide. They'll tell it to make more epithalamin if you're using the Alavita patch. It'll tell it to make more melatonin if you're wearing the silent neck patch, and on and on and on. And each patch is designed to elevate a different peptide because it's a different frequency stimulating those antennas on your skin. We all know this, and we get down to my heart story. Come on. Oh, this is the older one. Shoot. I opened the other one, but I'm going to have to get back to the screen share. Are you still there?
I am. Can you screen share okay?
Stop. You could see that one, right?
Nope, I can't see anything yet.
No, before.
Oh yeah, before we could, yes.
Okay. All right. Not 1 second here. I don't know why it's doing this.
Is it not allowing you to screen share?
No, it won't let me. I'm going to scroll through. It opens up and it won't let me minimize. That it would save in a slightly different format. Well, okay, here we go. Now I'll get back. Oh, shoot. Take me all the way back. I don't know what's going on with that one. Let me try another one. This one will do it.
Technology is a beautiful thing.
Sometimes. Other times, it's a pesky little brat.
A toddler sometimes.
But I found it. Okay. All right, here is my heart story.
Wonderful.
So, has anyone ever had anyone say, well, I used the patches for a few months and I really didn't feel anything? Folks, I didn't even know I had a right bundle branch block when I started using the patches. And during the time I was using them, I had 2 stress echoes that I'll talk about. So I had PVCs my entire life. I knew it in high school. I was a long distance runner. It didn't bother me when I was running, but when I was at rest, I could feel my heart kind of skipping a beat. When my mom and dad would take us to get our physicals, the doctor would say, he has a heart murmur. And that's all I ever knew about it. I did not know I had a right bundle branch block that has to do with the conductivity to the right ventricle that pumps blood out to the lungs to get oxygen. And then it comes back to the heart and out to the body. But here's also what I didn't know. A right bundle branch block is associated with increased risk of all-cause mortality. And if you have a heart attack and you have one of those, you're done. So the block is here. Here's the right bundle. So here's the right bundle branch block. This is the right ventricle. And here's the sequence of events. I noticed I had PVCs when I was younger. I started using the patches in April of 2020. August 2020, the PVCs changed and they got really rhythmic and it was scary. And it turned out to be a good thing, but they got every fifth beat, day and night, fifth beat, fifth beat, fifth beat. I was taking my pulse, and Carla and I were lying in bed and say, "God, it's skipping a beat every fifth beat." I have this knee replacement surgery coming up in the third week of August. I should call the cardiologist because something's going on with my heart. It's weird. Well, what I did is I put an X39 on the back of my neck, but since I'm a man, I thought more would be better. So I put a second one right over my heart. And it turns out that is actually true with the patches. If you put a second one on, you'll get about a 20% bump in whatever it elevates. So I didn't know that yet, but I got my two on because I'm a man. And then they changed to every fifth beat. I had a stress echo in August of 2020 that showed I had the right bundle branch block. 2 weeks later, the PVCs were gone. And this is my theory. I have no proof. But when the doctor came in and said, yeah, your heart did really well on the stress echo, it responded well to exercise. I wanted to say, yeah, I've known that for 40, 50 years. But you just have this right bundle branch block in PVCs. And I said, well, what causes that? And he says, well, just like everywhere else in our body, we have these apoptotic cells. Cells are killed off because they're old. You just can't replace them fast enough in the heart. And the light went on, I went, oh my gosh, I have all these stem cells now. They're replacing themselves. They just don't know how to beat yet. And they're all doing it at the same time, skipping a beat. I don't know if it's true, but 2 weeks later, they were gone. Here's the first test. And I don't know if you can read this, but it says the baseline ECG shows a sinus rhythm with a right beat BB, right bundle branch block. Down at the bottom, it says compatible with a right bundle branch block. So here's my second one. I'm going to zoom in right here. Right bundle branch block is no longer present.
And what was the time frame in that?
About a year and a half.
Okay, a year and a half.
And here's on it's called My Chart. I get this message on My Chart. It's an app. Hi, John. Dr. Ryder's reviewed your nuclear test results and is pleased to report everything looks great. Your study was normal with no issues noted. 2 cardiologists have said they've never seen a right bundle branch block go away. So I'm just going to get really personal right now. How important was that to me? My wife, my 10 kids, my 26 grandkids, that grandpa is going to be around longer and productive longer and not going to be plagued with this lurking problem in the background. And this used to be me right here. You can see how gray my hair was. It's changed quite a bit. It started turning brown from back to front. It was all gray. And some friends said, "Do you realize your hair's turning brown again?" I said, "Get out of here." No, it's not. Bent forward, they took a picture of this. So that's what my journey has been, and how much when somebody says, I've used them for 2-3 months and I just haven't felt anything. How difficult do you think it is for me to say, you idiot? I don't say that. I think it, but I don't say it. But I say, well, what are you using to measure? Are you measuring all of your blood levels of your chemistry panel? Are you measuring your vitals? Are you doing tests? What are you measuring? What do you mean you don't feel anything? Your liver might be regenerating. Your bone density might be being restored. You're this, you're that. Your chemistry panel may be changing. Don't tell me you didn't feel anything. Of course you didn't. There are 99.9% of the things that go on in your body that you don't feel. Jim Fixx, the guy who popularized jogging, died at age 42 of a heart attack. He was healthy. You don't know what's going on, so be passionate about that. I mean, we don't want to be ornery or mean, but ask them, well, what do you mean you don't feel? Or what are you using to measure that? If it's pain that goes away, it's easy to notice that. If it's some dysfunction that goes away, it's easy to notice that. I didn't know I had a right bundle branch block. Here's what it would have been. I would have not known I had a right bundle branch block. I would have used the patches for 1.5 years. The right bundle branch block would have gone away, and I never would have known I had it or that it went away. So that we have to keep in mind when we're using the patches, what's going away. I can tell you this, and it's probably time for me to let Stacey talk a little bit. We all have a lifespan. We don't know what it is. We know when we're born, but we don't know when the end is. There's only one person that knows that. What we have control over is that percentage of our lifespan that is our health span. The patches can help us increase the health span. And if these 3 things are true when you're old, there's a lot wrapped up in it. 1, I remember who I am when I'm in my 2, I'm not meeting a new person in my house every 15 minutes who's my spouse. I am able to go visit people. They don't have to come and visit me. Those are some of my 3 goals for myself and my wife as we age. And if those are true, she and I are traveling and we're not bedridden, where people have to come to visit us.
Those are very important goals. Very important. And those are things that people need to start thinking about even in their 30s and 40s. And especially when you get into your 50s and 60s, as our stem cell production declines. Those are fantastic goals. Now, Dr. Harmon, they're asking me, what patches did you start with? What patches did you use during that 1.5 year period of time? And here you are over 3 years later. What patches are you still using, and why are you still patching?
Okay. Well, I have to be frank with you. I didn't even know about any or much about the other patches. I didn't know about the comp plan. I got this notification, hey, you reached the manager level. I wonder what that is. Hey, you reached the executive director level. I knew a little bit more about it then, but I can't say. I just went to work. I knew that if I just kept bringing people in, right side, left side, right side, left side, I was going to build a business. And I didn't know what the other patches were. And then when I found out, David did a couple of things. We didn't have the education, the series that David does. We had one like every other month. He did a thing and found out about the carnosine. I thought, I should start using that one. I knew the AON decreased inflammation. But at first, it was mainly the X39. I did add the AON, the Alavita, the carnosine. It's not like I can just say it was all X39. Maybe it was, but I don't know for sure. But today, I use the X39, the X49, the energy enhancers, the AON, the carnosine. And there's one more in there somewhere.
Glutathione.
Biggie. And here's another thing where you don't know something. How do you describe something you don't have? You're not even aware of it. You know, you don't have it. So you don't talk about it. You don't think about it. But I get my haircut. I've gotten my haircut from the same barber for probably 10 years. And the guy next to him, my barber owns a shop, and there are other, chairs. And the guy next to him is usually busy. So I hadn't had a chance to talk to him for a couple of years. And a few months ago, he didn't have a client. And he and I started chatting. And after a few minutes, he said, "You don't fall asleep anymore."
What?
Oh my gosh. I used to fall asleep every single time. Every single time I got my haircut. And I
Wow.
forgot about it, because how do you describe something you don't even have? You don't think about it.
Mm-hmm.
I said, "Yeah, you're right. I don't fall asleep anymore." And the energy enhancers don't give you a buzz. You're not all ramped up. It's just a lack of fatigue,
Mm-hmm.
lack of feeling tired in the afternoon. So I use the energy enhancers as well. My wife and I are I use the Dream and the Shine now. There aren't any of the products I don't use. Why wouldn't I? I mean, let's see. What do I want more? A right bundle branch block? Or do I want to spend a couple $100 on patches? Do I want to spend hundreds of thousands of dollars later for healthcare? Or do I want to spend $300 or $400 on patches that help me stay healthy?
Big choice there. And especially when you think about your quality of life, not only yourself with your wife, but also with your 10 children and 26 grandchildren. Having that energy, having that vitality with them, that's going to continue in their minds for years and years to come. Even when you do live to be 150, 200 years old with the rest of us patching, they're still going to be like, my great-great-grandpa, he's still kicking over there in Idaho, doing his brain stuff, patching people when they come in. That's important. That legacy that you're leaving because of a choice you made in wellness and in your future. And I mean, it's priceless. It really, really is. We only have a few minutes, but I do want you to share with them the X49. I know you talk so passionately about the benefits of that with the 39. So can you tell us a little bit about the X49 and your specialty and what you do with that?
Yes. The X49, well, let me rewind. The AHK copper peptide is essential in bone building. It's used. It disappears. More of it is cleared out of the blood when you're building bone. But we walk a delicate dance all day long between bone building and bone destruction. Bone building happens when you're exercising. The body says, "Oh, I need stronger bones. I'm going to put more bone into this." "Oh, no, this person's been bedridden for 2 months. I don't need this much bone structure anymore. So I'm going to take a little bit of it out." Well, the study that was done was measuring the AHK copper peptide, and these, they're called terminal, the connections that connect collagen fibers together. When your body's destroying bone, it's breaking down the collagen, and then these things end up in your bloodstream, and that says there's more bone destruction going on. They showed that wearing X49, there's more bone building, and that's really all you need to know, that it helps restore and maintain healthy bone structure. But it also, that AHK copper peptide forms a Faraday cage inside of you. Copper is what's used for Faraday cages. So like a Tesla, Faraday cage. So I do testing when someone comes in, and there's actually a new diagnosis called electrosensitive. When I had my chiropractic tables, I'd have patients come in and they were electrosensitive. I couldn't even have the table plugged in. It couldn't stand the the EMFs coming from my table. So this helps build this Faraday cage to keep the EMFs out.
Mm.
Folks, we're not going to do anything about those 5G towers. We're not going to be able to stop them. We're not going to be able to do much about Verizon and all those towers, but what we can do is protect our body from those things getting in. And so you can actually find a strong muscle on somebody and then have them hold their phone up to their chest and then call that phone, test that muscle, then they won't have any strength in any of the muscles. Their postural muscles, okay, but their voluntary control muscles, they go weak. Sometimes I'll use the muscles of gait, like right arm, left leg,
Mhm.
and they won't even be able to hold them up when their phone's ringing on their chest. Put the X49 on it, do it again, rock solid in those muscles. And what does that mean? Well, when I use the muscles of gait, I say, do you realize that your phone and all these EMFs are affecting your gait? Do you realize how important that is, your gait? If you're not walking right, you're going to wear your joints out. So that's pretty impactful when you can do that.
Mhm. That makes a huge difference. We're all bombarded by detrimental EMFs, and that's definitely another amazing perk and benefit to using the X49 as well. So, Dr. Harmon, we have about 1 minute left. Do you have any last comments or thoughts or anything? Everyone is just blown up the comment section and how grateful they are with all the information that you've shared tonight. Do you have any final closing remarks that you would like to share with everyone?
Yes, and I thought about this, and I want to address just briefly, people get really frustrated and they might not get the benefit from the X49, X39, whatever it is, the patches. Most diseases are caused by a long-term exposure to some kind of pathogen, viruses, bacteria, fungus, parasites. The X39 activates our immune system. What if our immune system is so sick, I can't kill off those pathogens? You might be having a chronic infection of a parasite you don't even know you have. Parasites can cause neuropathy. They cause tingling and numbness in your extremities because they poop ammonia. And so find a practitioner who's really good at helping unravel all of that. The other thing is some things that can impede or prevent copper absorption. We have to have copper in order to make copper peptide. Use chlorophyll, take a couple of droppers full of that a day, you get an ample copper. But here's the kicker, and this is in the book as well. If you're taking high doses of zinc, it inhibits absorption of copper, and you will not respond to the patches as well because you're not getting enough copper. And so keep that in mind. Those are things, though in my journey of digging through all of this stuff about copper peptides, those are some of the nuggets that I have in the book.
Wonderful. Well, we're all looking forward to that. So be watching Dr. Harmon's page on Facebook. He will be sharing that link when that's available. And of course, send him that email if you would like a signed copy. This recording, of course, will be up on my YouTube channel as soon as it gets downloaded to my computer. So thank you so much, Dr. Harmon, for taking the time out this evening of your busy schedule to come here and pour into everyone. We had over 300 people on here tonight, and I know we'll have thousands that watch the recording. So this information was completely valuable and so informative for everyone that is watching. So thank you so much for taking the time to do this. I really appreciate you. If you have any other questions, please get back with the person that invited you. They're going to be able to help you answer those and get you the information about the patches and what works best for you and how you can get set up that with the technology as well too. So thank you all for being here. Thank you, Dr. Harmon. Everyone have a fantastic evening.
Thanks so much.